Welcome to Retire Right Washington. The team at the Retirement Solution has been helping families plan for a successful retirement. The Retirement Solution helps you learn about strategies for creating income in retirement, managing your wealth, and minimizing taxes. Welcome to Retire Right Washington.
Do you know the true cost of healthcare to you in retirement? Well, one of the biggest surprises you could face in your retirement journey could be healthcare costs. Many people aren't prepared for how quickly those costs can add up, but there is some good news here. You can take control and plan ahead. Today on our show, Tom Black and Matt Perrone are here to help you understand ways to preserve your savings from the rising cost of healthcare. Welcome everyone to Retire Right Washington. I'm Megan Mozak, and it's great to be back with Tom and Matt. We're going to talk about this healthcare risk in retirement. It is a big one. I want to kind of dive right into it as we get started here. And when we look at this, Tom, we see healthcare is expensive no matter what, right? If you're raising little kids, it's expensive. But this starts to really become a risk in retirement. Why is that?
Well, it's because it's such a consistent month after month expense that you have. We all know that healthcare is expensive. It's not like back in the day when, it costs you $30 a month, for you and your family for healthcare. It's expensive, and you need to be thinking about how we're going to pay for this, because it does add up over time. You'll see studies that'll say, 20% or more of your entire retirement will be spent on healthcare at some point during the course of your retirement years. And so you want to be thinking about how we're going to cover those costs. We're living longer. I'm always amazed at the changes in healthcare that are happening right in front of us. And you can name any of them from, what they used to for heart stents. You'd stay in the hospital for 2 weeks to now one of my clients had it done through his wrist, as an outpatient. And so these things change, and we live longer, and we know more about how to take care of ourselves. So it's going to become more of a cost for us. And that doesn't even get into some of the later end of life kinds of expenses that can be out there.
Yeah, really exorbitant when you start to add it all up. And I wonder, Matt, as you sit down with families and couples and individuals, do people start to underestimate some of these costs?
They certainly can, yes. And that happens for a couple of different reasons. The first one, I think, is just because people anticipate once they turn 65 that, Medicare's just going to cover everything. I pay, what is it now, $180 a month approximately, or something like that. And what they don't realize is that that's only a base Medicare plan. You may need other things on top of that to cover larger expenses. It goes up each year. But I think another part of it too, though, Megan, is that it's just so unknown. Your end-of-life cost, like Tom said, for example, well, that could be zero if you just go to bed one night and don't wake up, or it could be hundreds of thousands of dollars if you need some sort of prolonged care situation before you die. Well, how do you know what's going to happen to you? So I think some people just say, I'm just not going to think about it. It's in my end of life. It's not comfortable. I'll just hope for the best.
This is not something that you want to just hope for the best, right? I think we can try to do that, but you need to plan for the worst, Tom, to finish that statement.
Yeah.
How are you helping people do that?
What we're trying to help people do is really look at what are those costs. Matt mentioned, the cost of Medicare, and it does go up every year. You've got to have some supplementals to go along with that to help cover some of the other costs that aren't covered by Medicare. You've got your vision and dental that are also not covered by Medicare. So there's lots of things that we want to make sure people are thinking about in their expenses as we're putting together a plan. And it's the combination of all those things that make a difference. And sometimes it's little things that sneak up on you. You're on Medicare now, and now you've got Medicare Part D, and you've got Medicare Part A, and then you've got, and it's a lot of alphabet soup, and it can be very confusing. And trying to figure out which way to go is confusing. So it's all of these pieces that you want to make sure that you are thinking about, and you have someone to help you through. We work with our clients to help them understand all of these different pieces. And the great thing about being in this world that Matt and I are in, and the rest of our team, is we're able to gather experts. We don't have to be an expert on Medicare. We have access to someone who is. We don't have to be an expert in legal. We have an attorneys that are. but we're able to really help coordinate that for our clients so that they can get that complete view of what they need to do.
You know, another aspect of that really briefly too is we see a lot of people who have plenty of means, but maybe they're only 62 and they want to work until they're 65 just to make sure they have that Medicare coverage. And you know, sometimes we'll be able to say, well, actually, what if it was possible that if we found you one of these professionals like Tom's mentioning that could find you some sort of out-of-pocket private health insurance plan, and yes, it would be expensive, but if it's only for a few years in your plan, let's find a way for you to afford that so that you don't have to work just to have health insurance.
Right, and putting off retirement
Yeah.
because of that. Okay, so this is not something to ignore. It's something that also, it sounds like it needs to be integrated into your overall plan, and this is why you need that trusted advisor and the written plan. All right, Tom, Matt, we're going to keep this conversation going here, and coming up, we'll dive into some simple strategies to help you prepare for these costs and to keep your savings safe. And later, Matt will cover some of the things you should know about long-term care. Stay with us.
On the surface, your retirement plan might look solid. With your 401k or IRA, Social Security, investments, and insurance coverage, you appear to have it all covered. But what could you be missing? Below the surface, is your retirement exposed to too much risk? It's time for a deeper dive into your portfolio. We can help you uncover the risk that lies beneath the surface and learn about strategies to help preserve your savings. Get your free risk analysis today.
When it comes to planning for the future, time may not always be on your side. Think about your taxes. Tax rates are historically low right now, but they'll likely be higher in the future. With the right planning and strategy, you might be able to cut your tax bill in the years to come. But don't wait until it's too late to take advantage of today's lower tax rates. Let us be your partner in planning for tomorrow so you can enjoy your retirement today.
Planning for retirement can be complicated. Helping create income that lasts, making sure your health care is covered, investing while managing risk, and don't forget about taxes. If you're overwhelmed, you're not alone. The good news is we have what you need to give you confidence to start planning for your ideal retirement, all in one convenient resource. You'll get answers to some of your biggest retirement questions in this easy-to-understand, practical resource. And best of all, there's no cost to you. Take the first step toward a confident retirement and get yours today.
And welcome back to Retire Right Washington. Earlier we were talking about how those big healthcare costs can sometimes pose a risk in retirement, and that's not something you want to let your plan become susceptible to. When we're talking about these risks, you know, taxes usually number one in terms of expenses, healthcare not far behind, right? So I want to talk about this because there are solutions to this risk of healthcare costs. Let's talk about this, Matt. How do you walk people through the options that they do have to try to keep the costs in check?
Yeah, keeping them in check is a good way to say it, because eliminating them entirely, not so much the goal, but keeping them in check you can. So it would be a part of the first base plan that we would run in terms of just their normal investments. But then things you could layer on top of that, an easy one to start with would be what are called HSAs, or that stands for health savings accounts. If someone's already retired, it might be too late to start one of those, but for anybody out there that's still working, see if that's something that your employer offers or that you can start on your own. Those are wonderful accounts that you can get a tax deduction to put money in. It grows tax-free, and then when you take money out for medical expenses, you withdraw it tax-free. So wonderful option there. Beyond that, you want to start looking at what your health plan actually covers. So there's Medicare, for example, but on top of that, you typically want to get Medigap or some sort of supplemental plan that gives even more coverage than what just base Medicare does. And then after that, once you really start getting beyond it, that's when we start to look into long-term care insurance or other ways to protect clients from those long-term care costs. Sometimes it's an insurance thing, sometimes folks are self-insured, but these are all the options to look at to make sure that, hey, if something happens to me, I'll be okay.
How do you start to integrate this, Tom, into the overall plan? Because I think when we start adding up these costs, people say, okay, I built up this really impressive nest egg, but boy, it sounds like healthcare is really going to dip into this. Are there ways to try to mitigate that risk so that you can still have the retirement of your dreams?
I think so. I think, again, we want to get organized. And we keep talking about getting organized around what your goals are. And you want to start with being able to pay or to do the things you want in your retirement. And as we get that pulled together, then we can start having a little bit harder conversations about, well, I really feel strongly about long-term care because grandma, was in a home and she was there for a number of years. I want to make sure we have that covered. And it's okay, great. Let's figure out how we can cover that. And how does that affect your retirement? Because again, there's only so many dollars and we get to put them in different slots. And so it's the knowledge that helps take away some of that fear. Oh, okay, we understand we can do this or that, or what are the better options for us? Because there are a good handful of reasonable things you can do to protect for things like long-term care or other medical expenses. But you want to start first with what do you got and how are we paying our bills for the next 30 years, not so much what happens in the last 5. Because unfortunately, there's cancer, there's buses, there's all kinds of things that happen, and now you've put off doing the wonderful things for an expense you never actually have. That would be a whole nother show. We start talking statistics on that kind of thing. But I think first off, just getting organized and so you can have a better feel for where you really are.
And this is something none of us should be ignoring because healthcare, it affects all of us, right? Whether you saved $1 million or $10 million for retirement, it's going to affect you and you need to have that plan. And on that note, Matt, I want to ask you, how can we then start to estimate when we don't know what's coming our way? Tom was talking, we don't have a crystal ball. How do we estimate and then plan accordingly?
Yeah, so estimate is a good word. The conversations that we have with our clients typically start with us saying, hey, we don't have the crystal ball, but let's do our best guesses here. Are your parents both still alive? Okay, well, one of them is. All right, what about your other older siblings that are reigning? How did they go? Your family history can inform some of that. Your own health can tell you some of that. How do the doctors say that I'm doing? And so what we'll typically end up doing is just based on what clients, some of their family history, but also some of their own personal, I guess the best word would be health risk tolerance as opposed to investment risk tolerance. We'll help them find a way that says, listen, you could buy this insurance to offset the risk, and it's going to cost you, though, a little bit each or a decent amount each month, and that might eat into your discretionary spending. And some folks are okay with that. Others will say, hey, I'm pretty sure you could handle this on your own, but there is a little bit of risk here later on in life. And they'll say, I'm okay with that because we have the house, or we have, this, our kids have told us that we can live with them for a little while if it really gets bad. You start to just run the gamut and run some simulations and say, all right, what's going to work best for you? Okay.
Again, coming back to that individual plan.
Mm-hmm. I would say, and I also think there's also a lot of things now. Technology is an amazing thing. And so there are calculators we can also look to. Mm. We just saw Social Security release a new life expectancy. You can look that up online and be able to see how long you ideally will have based on your age. I looked up mine. It seems short. When I look at it, been around for a while. I keep thinking I'm only halfway done. I probably don't want to be, but still, there's lots of other tools as well that we can look to help kind of give people an idea of where they're going.
Okay, so in lieu of a crystal ball, we've got some good calculators, right? I'll take it. Whatever kind of technology that we have, that's important. All right, Matt, Tom, thank you. Now coming up, Matt is going to fill us in about long-term care. That is a cost that seems to keep rising, but he's got some good insights. So stick around. We'll be back right after the break.
Planning for retirement can be complicated. Helping create income that lasts, making sure your health care is covered, investing while managing risk, and don't forget about taxes. If you're overwhelmed, you're not alone. The good news is we have what you need to give you confidence to start planning for your ideal retirement, all in one convenient resource. You'll get answers to some of your biggest retirement questions in this easy-to-understand, practical resource. And best of all, there's no cost to you. Take the first step toward a confident retirement and get yours today.
On the surface, your retirement plan might look solid. With your 401k or IRA, Social Security, investments, and insurance coverage, you appear to have it all covered. But what could you be missing? Below the surface, is your retirement exposed to too much risk? It's time for a deeper dive into your portfolio. We can help you uncover the risk that lies beneath the surface and learn about strategies to help preserve your savings. Get your free risk analysis today.
When it comes to planning for the future, time may not always be on your side. Think about your taxes. Tax rates are historically low right now, but they'll likely be higher in the future. With the right planning and strategy, you might be able to cut your tax bill in the years to come. But don't wait until it's too late to take advantage of today's lower tax rates. Let us be your partner in planning for tomorrow so you can enjoy your retirement today.
How does your future look in retirement? When you don't have a strategy, the future might look a little fuzzy. But with someone asking the right questions and helping you learn where you truly stand, it can become easier to work towards your goals. You need a plan to help generate income that will last as long as you need it. And the first step to creating an income plan is an analysis of where you are now. Let us help you bring your retirement into focus with your free income analysis today.
Welcome back. Now, according to statistics, most of us are going to need some form of long-term care in our retirement. And it's not cheap. Those costs keep going up. But Matt is here, and he wants to talk to us today about a way that we could think about paying for this major expense. Matt?
All right, thanks, Megan. So folks at home, I want to talk to you for just a couple of minutes about long-term care. Okay, and I want to tell you basically two things, and two things only, that will help you make sure that you know in your world that you're taken care of when it comes to all of the considerations in this conversation about long-term care. So let's go through these really quickly. First, the number. What the statistics say, and what a lot of people will use out there, and it's a true number, is that about 70% of us that are here in the US will need some sort of long-term care before we die. Okay? And so 30% of us will go to bed one night and just not wake up, but about 70% of us will need some sort of care. All right, if I was a long-term care insurance salesperson, I would probably use that stat to get you to buy insurance. And that's not the reason I'm using this stat. I actually want you to dig a little bit deeper into this. There's a part two of this 70%, if you will. Okay, the first part is 70% of us will need long-term care, but of that 70%, about 70% of that group will actually only need that care for 1 year or less. What that means for you is that for actually the majority of folks that are mentioned in this kind of research, yes, there will be some expensive care, but it's pretty temporary. And so what that can inform you on is that the statistics actually say most of us won't have that much of an expensive stay in some sort of long-term care facility. Now, you still could. Please don't hear me say that, oh, great, Matt said I don't have to worry about it. That's not it at all. But I do want you to see what the numbers really say. Now that we know the full story of the 70%, that's where the word insurance comes into play. And insurance can also mean one of two things. It could mean going out and buying some sort of long-term care policy that allows you to have an insurance company now take on the risk of any long-term care expenses that happen to you. There's a few different types of policies that exist out there. Another way that people go about being insured, though, is they don't buy an insurance policy. Basically, through some math, we can help them determine that they are what we call self-insured. And if you're self-insured, then you know that, hey, you know what? If this actually happens to me, or if it happens to my spouse, I can draw up my financial retirement plan in such a way that even if it does, I will be okay because I've got these funds that are set aside, and we can do some projections on them with growth and with average spending, this and that you'll be okay, that you'll have the money that you need to take care of this. All right? So that's in a nutshell the long-term care conversation that we have with folks when you come in to sit down with me or someone else on our team. We'll go through the statistics and what they say, how they apply to you in terms of your family history, and then figure out one way or the other for you to feel the comfort of being insured against any potential like that. All right? Megan, back to you.
Thanks so much, Matt. Your questions answered about retirement. That's coming up next in our Q&A segment. Stay tuned.
How does your future look in retirement? When you don't have a strategy, the future might look a little fuzzy. But with someone asking the right questions and helping you learn where you truly stand, it can become easier to work toward your goals. You need a plan to help generate income that will last as long as you need it. And the first step to creating an income plan is an analysis of where you are now. Let us help you bring your retirement into focus with your free income analysis today.
On the surface, your retirement plan might look solid. With your 401k or IRA, Social Security, investments, and insurance coverage, you appear to have it all covered. But what could you be missing? Below the surface, is your retirement exposed to too much risk? It's time for a deeper dive into your portfolio. We can help you uncover the risk that lies beneath the surface and learn about strategies to help preserve your savings. Get your free risk analysis today.
Planning for retirement can be complicated. Helping create income that lasts, making sure your healthcare is covered, investing while managing risk, and don't forget about taxes. If you're overwhelmed, you're not alone. The good news is we have what you need to give you confidence to start planning for your ideal retirement, all in one convenient resource. You'll get answers to some of your biggest retirement questions in this easy-to-understand, practical resource. And best of all, there's no cost to you. Take the first step toward a confident retirement and get yours today.
When it comes to planning for the future, time may not always be on your side. Think about your taxes. Tax rates are historically low right now, but they'll likely be higher in the future. With the right planning and strategy, you might be able to cut your tax bill in the years to come. But don't wait until it's too late to take advantage of today's lower tax rates. Let us be your partner in planning for tomorrow, so you can enjoy your retirement today.
Glad you're with us today. It is time to jump to your questions about retirement, and to answer those, the gentlemen to my right, Tom and Matt, are here from the Retirement Solution. You guys ready for this?
Absolutely.
Sure.
Born ready, right?
Born ready.
Born
Let's
ready.
Do some more.
Okay, so let's get to our first question because we have a lot, and we're going to start today with Tom. It's from Lucy in Renton. She says, what exactly does Medicare not cover, and how can I prepare for those costs?
Well, Lucy, I'm going to tell you the easier answer is what does it cover? Because there's so much that isn't covered with Medicare. It's going to cover seeing a doctor. It's going to cover, well, kind of cover what you see at a doctor, not all of it. And it's going to cover you going to the hospital. And that's it. The rest of the stuff that you can think of isn't going to be covered in there. And that really gets into some more conversation that you need to have and understand, because all of us get into this Medicare world, whether we want to or not. And so understanding that's important. And it does have a direct reflection on the expenses you're going to have in your retirement. So if you don't understand it, it can be a real problem later on.
What about ears, eyes, teeth?
Not covered.
Okay, I figured
covered.
that was the case. All things that typically you're going to need more services for as you get older.
Well, not only that, you assume because you had health care when you were working and all those things were kind of part of it, that all of a sudden when you get to Medicare, the world's different. And things that you were used to aren't there anymore. Mm-hmm. And so you really want to start digging in, or really have someone you can trust that can help you do that. I think we mentioned this in this segment. You know, we can't know everything about everything, but what we do is we gather a lot of really good, smart experts in all these different areas so that we can help make sure our clients are ready and understand these different pieces so they know how it affects them.
And it's especially true with, like you said, most of the time we're just used to our employer plan. We have one or two options. With Medicare, there's a lot more than two options.
Oh my gosh, yes.
And you talked about the alphabet soup with Medicare. And I'm sure, you know, for those of you who are getting all that information in the mailbox nonstop, and you're trying to make sense of the alphabet soup, you talked about having access to those professionals, those experts. Right. And that means clients of the Retirement Solution have access as well.
That's correct.
Absolutely.
That's what we have them for.
All right. It's a lot to navigate.
Yes.
All right. Next question is for Matt. And this one comes in from James in Sammamish. And James says, how do I know if long-term care insurance is right for me?
So James, what you're going for there is it could be right for anybody, because any of us could have long-term care needs in our life. But whether it's right for James specifically, that's going to come down to a conversation, I would say, between James and someone on our team or me, or really any of our clients when it comes to this. Because you've got to factor in cost. You've got to factor in, I think in the previous segment we used a phrase like healthcare risk tolerance. How okay are you if something happens later in life and you still have to pay for that yourself? So we'll want to look at that. We'll want to look at, could you pay for something yourself or could you not? We want to look at family medical history. Those are all things to help us know if it's right for you or not.
Okay, looking at each person's individual situation. Tom, here's our next question. This one is from Anita in Bothell. She says, at what age should I start thinking about healthcare costs for retirement?
Anita, I'm betting you started thinking about this long before you thought about retirement. So really, this is something that one of those concerns. Let's not call it a fear. Let's call it a concern that people have going to retirement. It's one of the top 4, and so everyone's kind of thinking about this. I think the sooner you start educating yourself, the better when it comes to healthcare in retirement. And you really want to be thinking about this definitely within the 5-year window of the time when you think you're going to be retiring. So you know how you're going to cover that. I mean, what you don't want to do is you don't want to stay at a job that you are tired of, worn out on, just because I got to hang in there till I'm 65. There could be other options. There could be ways to cover that health care so that you can move on with your retirement, do the things you've always wanted to do, rather than sticking to a job just because you need the health care. And that's true for both you and your spouse or whatever your situation happens to be. It's just really knowing what your options are.
Okay, and it's good to have options.
Always good to have options.
We like that. All right, Matt, we have another question, and this one comes from Peter in Burbank. Peter says, what can I do to stay healthy so I don't have to worry as much about costly health issues?
Oh, this is perfect. Some people might be thinking, why would a financial advisor give me advice on my health? But this is actually right up our alley. What we have seen over and over again, what we're able to observe from our side of the table, if you will, because we meet with the number of people that we do, is there are life habits that some people have that keep them healthier, and there are habits that others have that aren't so healthy. And I mean more than just diet and exercise. Like, you can go to a nutritionist or a doctor for that. Mm-hmm. But things like, how strong is your social circle? How close are you to your family members? These are things that can actually help. Are there causes that you're dedicated to? Like, those things can have an impact on somebody's health and feeling of well-being. So those are things I would absolutely encourage people to get involved in.
Okay, and beyond, of course, all of the other things we hear, getting in your steps and watching your carbs and things of that nature. And of course, even the healthiest people, accidents can happen, right?
Sure.
We don't know what's in our future, so planning ahead, it is so key. All right, it's always about that plan with Matt and Tom, and we appreciate you sharing your insights today, as always. So if you're ready to create a tax-efficient retirement plan designed to protect your wealth, if you want to generate income for life and leave that lasting legacy, now is the time to connect with the team at the Retirement Solution. For Tom Black, Matt Perrone, and the entire team there, I'm Megan Mozak. Thank you for joining us. We'll see you next week here on Retire Right Washington.